Health Minister Dr. Christopher Tufton, in a press briefing earlier this evening, gave an update on the COVID-19 cases in Jamaica.
We have had no new case to report in the last 24 hours, 199 samples tested, 7 additional recoveries. 2 persons of the total number who are recovering that are critical, and those we have to watch. The rest are either mildly symptomatic or asymptomatic, which is very positive.
The total recoveries now number 368. Dr. Tufton also went on to outline breaches in observing COVID-19 containment protocols in nursing homes.
Some of the concerns that we have had, and I go through some of them because I want to appeal to persons who are involved in managing these facilities, but also relatives who have their loved ones in these facilities. Most of these persons staying, these patients who live in these facilities, have family members who take care of them. And it's important that we appeal to family members to insist that these standards are maintained, because that is actually in the interest of your loved ones and your family members. So we've had issues with inadequacy in the training of personnel with regards to cleaning and sanitation procedures, and that's a major focus of our officers. Inadequate hand hygiene facilities, again, standard protocol in infection prevention and control. No isolation area. If someone has symptoms, we have to remove them to an isolation area until they are appropriately assessed. And every facility should have an isolation area. No provision in place for social distancing or physical distancing, ensuring that common areas are sufficiently spaced out with appropriate seating arrangements, or otherwise dining areas, TV rooms, to ensure that the physical distancing protocol is maintained. Lack of running water in parts of the building where water is essential. So even if there is water, there may need to be adjustment in the plumbing infrastructure. Staff not complying with the PPE requirement, whether wearing of masks or otherwise. Inappropriate cleaning and sanitation chemicals that are used for cleaning the floors and other areas. Inadequate provisions made for additional potable water. Temperature checks for staff entering premises not being done, which is a critical component of the protocol, standard protocol, and temperature checks not being logged.
Now, Dr. Tufton said these breaches are easily remedied and urged nursing homes to do so. There are 204 nursing homes in Jamaica. 106 of the total were cited for breaches. Only 98 had a satisfactory report.